I remember that we both were working on getting the bloodborne pathogen standard passed through federal OSHA in the early 1990s. And in fact, there was a hearing scheduled for that purpose here in San Francisco. And I called you up and asked you if you could testify on behalf of yourself and your co-workers. I remember very distinctly that you told me something during that process that completely shocked me and troubled me, and I'm not sure exactly what I said to you, but...
You told me it was going to be all right.
Right. I think I did, unfortunately, say that.
Well, when Peggy told me what had happened to her, I was devastated, as anyone would be that knows her. And the irony of it, that the person most responsible for making a bureaucratic institution sort of actually look at what was going on and respond to it, which is the hardest thing to make an institution do.
I think that my emotions were complicated by the fact that Peggy is a woman and a lesbian, and all things being equal, is probably the least likely person to contract HIV. And it's her heroism and her choice to work with people with HIV that brought her into a risky situation.
About 1 million healthcare workers are accidentally stuck with needles each year, and increasing numbers contaminated with hepatitis B or the AIDS virus. Healthcare workers want the government to require safety regulations. One woman, identified as Jean Roe, says she contracted HIV from a needle left behind.
She left one of these needles on the bedside table. It was hidden by gauze. As I cleaned up the bedside table, the contaminated needle punctured my finger. I had no idea that a contaminated needle laid hidden from my view. I couldn't anticipate it, and I couldn't stop it. While I was doing my compassionate, professional best to care for my patients that night, I was exposed to an unprotected needle with enough HIV-contaminated blood to infect me and to change my life forever. But I did notice that when I came back to work, that third bed was gone. When I said all along for 5 years that that is a dangerous situation, 3 beds in 1 room.
It's meant for 2 beds.
Yeah, and the needle box is too far away from the bed. You know,
Right.
behind a curtain.
Right. The hidden sharps container.
Right.
Well, one study shows that 12,000 workers were infected with hepatitis B from needle accidents in 1 year, and that 300 of them died. 47 were infected with HIV. Henry Champ reports.
San Francisco General Hospital is crowded with high-risk patients, drug users, and people with AIDS.
Carrying an exposed needle, a contaminated needle, is a lot like pointing a loaded gun.
It's a dangerous situation in the nation's crowded hospitals.
Let's get an IV line into this arm because that'll save its life.
San Francisco General was reporting 20 to 30 needle accidents a month. Since then, the hospital is using new, safer, but more expensive needles.
You give the injection, and you pull up a hard plastic shield that extends beyond the point of the needle and then locks into place.
But very few other hospitals use the new needles.
Employers most concerned it's about money. Bottom line, employees can be replaced.
A Detroit hospital worker, Gwynn Spruill, showed a congressional committee a pile of contaminated needles and surgery tools found in discarded blankets and sheets.
If healthcare workers have to live in fear that a needle may be stuck under some gauze or something like that, and they're going to be stuck, that's just not acceptable.
Still, hospitals worry about the costs of new needles. Government agencies are slow to approve them, and it could be years before the unsafe ones are gone.
I was not able to see a doctor the night of my needle stick injury as a result of short staffing. I was able to call the next day to see a doctor and was not able to get an appointment until 2 o'clock, even though I told them that I had a serious needle stick. She told me that I could not have AZT because it was too late. And I felt that it wasn't too late, that I wanted to try anything. I went home and contacted some people I knew who did have access to medications in the underground, and I got AZT and was very sick on it.
I was on AZT for 3.5 years, and I did the antiretroviral path, and the quality of my life started decreasing because I was nauseous all the time. So decided to go off that.
Yeah, that's why I won't. I've never taken AZT. I took one, and I feel like it's really toxic.
It is,
and
feel it.
I'm the kind of person that I'm not sure whether it's having AIDS that kills you or all the drugs that they give you, you know, that make you really sick. And I thought, I feel fine now. Why do I want to take a drug that's going to make me nauseous, headachy, and tired? You know, when I feel fine now, it's like I'll take my chances.
There are many numbers of men involved in trials, and the drugs that are being given to the women were being tried on men. And so we're now experiencing that women are having side effects from these drugs because they were never tried on women in any trials. It has only been recently, in the last 3 years, that women have been trying to get into trials and have to fight, actually, to get into them. And if you're childbearing, you have to sign a consent saying that you will stay on birth control pills, which I don't think that any company or government has a right to tell you what to do with your body. I think that we have this disease and we should make the choice of whether or not we want to be in these trials, and we should be given that opportunity.
I take acyclovir to keep me from getting herpes outbreaks, because that started to be a problem for me. Every month I was getting an outbreak. And I take Scepter to keep me from getting pneumocystis pneumonia. And now they have me on an antidepressant, and which is, surprisingly enough, it's not covered under the AIDS drug program, which I think is...
It should.
Yeah,
it's depressing having HIV.
The way drugs are licensed for a specific use. In other words, a drug may be licensed for a sore throat, let's say. If you use a drug for another application, some of the HMOs say you can't use it unless it's written as an application. Well, HIV traditionally has used many drugs for off-label uses that are very effective drugs. So we can't really wait until it's written in the book. We have to do it before because we know it's effective. So off-label utilization was an HMO who absolutely refused to give people certain expensive drugs that were not listed as being indications. And what has happened now is, because of the efforts by the consortium, and they're basically political efforts and almost activist efforts, and the activist community in San Francisco, which has been really very active, we've been able to change the mind of HMOs. We've been able actually to change what is only being looked at in economic terms to try to make it more human terms.
Once I start getting into the population with AIDS people, I really realized that there was no risk for me to them. I was the risk for them, because if I had a cold or something, they were at risk for getting a serious infection.
About a month into the medication, I started developing severe pains in my legs, cramping in my feet, burning sensations that were just unbearable. So I went to see a neurologist, and he suggested that either the combination of the AZT and the tuberculosis drugs could cause the neuropathy, and to go off of them, and so and that it would resolve itself, but that it was most likely the tuberculosis drugs that caused the neuropathy. I was told at the time when I took the tuberculosis drugs that the one thing I needed to worry about was my liver and hepatitis, and to have blood tests done to monitor that. I was never told that one of the side effects of INH was also neuropathy.